More than 4,000 primary care nurses have walked off the job today seeking pay parity after more than a year of failed negotiations. Nurses organisation members claim primary healthcare and plunket nurses earn around 20% less than their Health New Zealand counterparts despite doing the same work, and they want that to change.
So we are really protesting to put pressure on the government to fund primary care equal to secondary care, i.e. DHBs, now known as Te Whatu Ora. So all our frontline staff have the same qualifications and go through the same training as hospital-based nurses, but are paid significantly less.
It's not just the last few months, it's the last few years. This has been the same issue that we've been bringing up over and over again. We need pay parity with our colleagues. It's only fair, and if we don't get it, it's the community health that will be negatively impacted.
The problem is the government funding. It's not our employers, it's the funding stream from the government. And we keep getting told that Mr. Little is listening. He's been listening hard for 14 months and we haven't seen anything at all.
Just one of the big things, we've seen heaps of information about wait times in ED over the past week. The reason that there's wait times is this reason right here. There's not enough nurses in primary care because our pay isn't being on parity with our colleagues.
It's not fair what we're going through, and all nurses should get paid fairly regardless of where they work.
I've only just started working and I'm getting paid the same as my part-time job that I was doing in uni, so it's the reason why I'm here. I just feel like it's sad that my classmates who graduated at the same time as me are getting paid much more than me already.
This area of primary healthcare is one of the most essential areas of healthcare. It's what pulled us through the pandemic. And when we're underfunding it so much that new nurses would be fools to actually enter this sector, that's a horrific start out for someone's career.
The government or the Ministry of Health has underfunded primary health care year on year, and now it's come to the point where Plunket cannot pay us because the funding hasn't kept up. People here are taking a 4 hours pay cut, which is significant, but that's how strongly we feel.
The big thing is that the government refuses to listen on this particular issue. They try and skirt the responsibility to private employers, but actually it's the Ministry of Health that's responsible for the workforce of primary healthcare nurses. And unless they step in and address this issue by properly funding our area, we're just going to see this sector fall apart.
Thanks for checking out our YouTube channel to stay up to date with all the latest news from the New Zealand Herald. Click the subscribe button below or check out one of the videos here, and head over to nzherald.co.nz for more details on these stories and more.